So cell differentiation, how do we know that what we're getting? There are different instruments that we can use, different cell counters and different flow cytometry monitors that we can use to assess what kind of product we have. We use those products even for lipoaspiration. So when we're doing, the liposuction and getting your own stem cells, this is how we're able to test to see what kind of stem cells and how much we're going to have. How do we know if product is, I don't know, not necessarily better, but something that's going to cause a reaction? We look at something called CD markers. These markers are on different cells, and they help identify those cells. So if we see markers with a lot of CD14, CD34, CD45, that would tell us that we have a lot of white blood cells and red blood cells, and those are not the cells that we're looking for. We're looking for more of the mesenchymal stem cells, and those would have markers like CD73, CD90, and CD105. Why do I tell you this? Because you're probably thinking to yourself, that's a lot of numbers and letters. Because if you are planning on having some type of stem cell deployment that's looking at non-autologous stem cells or growth factors or products, ask them, where are you getting it from? And ask them, tell me, what kind of ratios of CD14, 34, 45 that you have, and tell me what your ratios of these are. And if they can't answer those questions, find someone else, because they don't know what they're doing. So research growth, there's been a lot of research that's happened in the last few years. As you can see, this starts at 2008 and goes all the way to 2017, and we've seen almost a 5-fold increase in the number of publications that are out there on just umbilical cord mesenchymal stem cells. So the research is increasing, which is a good thing. We're still in our infancy, but we've already been able to do some amazing things with regenerative medicine. So right now there's about 137 clinical studies just on looking at umbilical cord stem cells, and not even including the other autologous options that are out there. Thank you for coming.